everyone, I am Carmena Marie Aling and today I'm going to report about the nursing informatics in China. As of January 1, 2020, the population of China was estimated to be 1.4 billion people. And as of February 2019, there had been a total of 33,000 hospitals and there were 550 million patient visits to hospitals. The primary goal of the Chinese government is Healthy China 2030. This has four core principles which are health priority, innovation, scientific development, and fairness and justice. For the health priority, based on the conditions nationwide, healthcare should be prioritized and placed in a strategic position in the whole process of public policy implementation. For innovation, the healthcare industry should follow government leadership, give importance to the role of market mechanism, and simultaneously speed up reform in key areas. In scientific development, there is a blueprint that emphasizes the importance of prevention and cure. And lastly, fairness and justice. In this core value, the rural areas of the country are given special attention to promote equal access to basic public health services and to maintain public welfare. So China has a big demand for healthcare as its population is aging so fast. And in its commitment to offer accessible and affordable care for all, the Chinese government is spearheading the development of healthcare technology. They constantly update their hospitals with the latest and the greatest technological advancements. So after we have learned a little information about China, let us now move to the history of nursing informatics. Everything started in 1970s. During this time, they began to use computers in hospitals. Hospitals in China incorporated information technology software into their payment and billing system, and many have also begun integrating it into clinical systems. In 1980, Chinese hospitals are in the midst of technological revolution. The increased authority of physicians, greater contact with the West, and increased funding for medical equipment are the key factors in these changes. In 1999, the first article referring to the term nursing informatics science appeared, and this led to the application of information technology in the field of nursing science for education and research. And in 2002, the term nursing informatics was first used in Chinese literature. China continued to develop its technology leading to what they have in the present. So now I would be discussing about the present use of technology in China, and let us see how advanced they are. The most promising technological advancement in China is the use of AI, or artificial intelligence. Artificial intelligence is stimulation of human intelligence processes by machines, especially computer systems. AI can help to make sense of large amounts of data fueled by computing power that has risen dramatically over the last few years. That is why China offers particularly fertile ground for AI development. With its 1.4 billion population, the country sits on massive troves of data. Imagine 1.4 billion people and you don't have advanced technology to cater all the data of each of them. With this, we can already see how important is technology to China. AI is already helping physicians with the analysis of medical images. And in 2017, the city of Guangzhou opened the first clinic in China to diagnose cataracts with the help of AI. In 2019, robots in China have been performing everything from bone surgery to brain surgery. An example of this technological advancement in China is the robot named Remebot. Remebot is China's first neurosurgery robot that has performed over 17 minimally invasive surgeries in 2019, operating in a way that does not necessitate cutting a significant hole in the skull and therefore minimizing blood loss. Chaotic relief is a welcome addition to Beijing's healthcare community, where reports of overworked staff are all too common. China is constantly updating their hospitals, and here's what you need to know about the latest upgrades in their healthcare operations in Beijing, which is their capital city. So here are the latest upgrades in healthcare operations in China. First is when Beijing hospitals rolled out mobile payments and online checking of laboratory test results. In 2014, Beijing hospitals first piloted a program that allowed patients to pay for medical care through WeChat and Alipay. And in 2019, all medical facilities in Beijing will accept mobile payments. And also, in 2019, hospitals have been trying out a system that lets patients to check results in their medical test online. Another important upgrade is the use of AI robots in nursing homes to rehabilitate the elderly. Chen Xiaoping is a professor at the University of Science and Technology of China, has been developing service robots which can provide services such as medicine reminders for over 10 years. A growing number of scientists and technological companies in China are working on AI applications to make the country's healthcare services more flexible. Another important technological upgrade is the use of big data. The McKinsey Global Institute defined big data as a large-scale data collections that traditional databases cannot obtain, store, manage, and analyze. They are a large amount of data collected from different sources, and the analysis thereof often described using the 10 V's. The 10 V's are volume, velocity, variety, veracity, variability, validity, vulnerability, volatility, visualization, and value. The core value of big data lies in the storage and analysis of massive data, and the strategic significance of big data lies in the specialization of data processing, in which the purpose of value-added data is achieved by improving data processing capability. Data of nursing science. In the era of big data and massive information, people are increasingly concerned about how to apply information technology to work and life, and massive unstructured data have been also widely used in hospitals. The most obvious changes are reflected in nursing services. Big data of nursing refer to the vast amount of data related to care and health, including big data of hospital nursing, big data of regional health service platform, and big data based on nursing research or disease monitoring in large populations. Big data could play a huge role in gaining insight into the value of data, preventing the spread of disease, eliminating the waste of medical resources, and avoiding the high cost of medical care, and could become a superpower that makes medical care more efficient. In traditional surveys in nursing, big data were understood based on electronic health records, claims data, and public health data sheets, while large databases of nursing are about nursing diagnosis, nursing intervention, and nursing outcome, and are extracted from large number of electronic medical records or EMRs through a general nursing classification. During the spread of coronavirus in China, robots were used as medical assistants to fight against the virus. These robots are 5G-powered medical robots equipped with cameras that allow remote video communication and patient monitoring, and for safe delivery of medical goods. In Wuhan, where the outbreak started, a robot spraying disinfectant moves through a residential area of the city. In hospitals, there are robots that checks temperature and disinfects people and spaces. Engineers have also modified the robots to record data and give feedback. Robots are used at hospitals to cut down on demands on medical staff. Engineering students modified medical ninja robots designed for stroke patients to make them useful with the patients who have coronavirus. The robots take patients' temperature and protect the safety of the healthcare workers by reducing interactions with the sick people. They also have screen allowing doctors to video chat with sick patients. And that ends my report. Thank you for watching.